and welcome to Health and Family. I'm your host, Shay Dawn Burgess. While many of us are familiar with the term lupus, how many of us are intricately aware of what the disease is and what it has done to some people in our community? Joining me to discuss the impact of lupus is Dr. Stanley James. He will be with us for the first half of the show, and in the second half we'll be meeting two individuals who have been diagnosed with this ailment. We want to welcome you, Dr. James, to Health and Family.
Thank you.
So let's start off by defining what lupus is in simple terms,
Sure.
as possible.
The body has a natural immune system. And the way it works is whenever something foreign enters the body attacks it. We call these with antibodies. Well, in this interesting case, the body has lost an indication of what is itself versus an enemy. And so the body's antibodies begin to attack itself. It's almost as if a police station started attacking civilians. That's how drastic and severe it is. So this protective system, the immune system, actually begins to attack the body's own proteins. And it's particularly in the soft tissues like the hands, the muscles, and the joints.
So where would an initial diagnosis be made? Here in Bermuda, or I know we have a connection with the Leahy Hospital.
Oh, sure. It's a clinical diagnosis that's confirmed with laboratory tests. And when you put the picture of what the patient is presenting with, it's the pains, the distribution of the pain in the body, and the other areas that are being affected, along with the ANA, which is the blood test we can use. We kind of put the picture together, and we make the diagnosis right here in Bermuda.
Oh, you can.
Yeah.
So the connection with Leahy is there something special, a special doctor, specialist?
Well, a rheumatologist, which is a subspecialty of the internal medicine division, will come once or twice a year at the Bermuda Healthcare Services, where they actually provide that service, and they will follow up the patients there. But general internal medicine physicians also are competent and can treat this effectively as well.
And we have quite a few doctors here locally.
Well, we have a few general internists here as well, yes.
Okay. So what are some of the common symptoms of lupus?
Right. So there are different types of lupus, actually. There is the systemic lupus erythematous. That's the most common one that people talk about. And systemic is across the body. And you find the body's, the soft tissues, the muscles, the joints, and the aches, around the fingers and the elbows, etc., are achy. And they're warm. People can have increase in temperature. And then you can have the discoid lupus, where it attacks the skin. You have little breakouts with elevated papular regions on the skin, which are tender to touch and kind of warm. Okay. So those are the two types. And then you have another one called neonatal, which is when a person actually has a child, you have an increased production of estrogen, which is pro-immunologic, and that will increase the likelihood of you having this immune response.
And that may have been gotten while the female was pregnant? Or?
Well, it will show up. So a person who has a genetic or environmental predisposition to the disease will actually have it manifest itself during times when there's increased production of estrogen. And so maybe around the time of her period, or also when a person is pregnant, you have an increased likelihood of it presenting.
Okay, so I guess depending on the type of lupus a person has would depend on the treatment.
Well, the treatment is pretty much standard.
Oh, okay.
It's to suppress the immune system.
Okay.
And so that's prednisone, cyclophosphamide, and there are different other types of immunosuppressive drugs that we'll use to kind of quiet it down. There is no definitive cure for lupus, and that's important to note. So we work with the patient depending upon when the symptoms come about and they get flare-ups, and we kind of treat them accordingly.
Okay. So most people, when we do say lupus, say females usually get it. Is that true? Yeah. Yeah.
Over 90% of the patients that present with lupus are actually female, in just it happens to be that way. There are theories and ideas as to why that may be. Some people feel that the female has a more robust immune system. And since they have a more robust immune system, when it attacks itself in a more robust fashion. And so that is one of the theories as to why women have it more than men.
And so ethnically, who gets it more? Caucasian?
Great question. The African American population is the one that's been studied. So the African American population in the cohorts that have been studied in the United States have a significantly higher percentage of incidence of showing up with lupus. And then the Latino population, they also get it as well, but for them it's more aggressive, and the end organ damage just has a higher, it's much worse. So they'll show up with an attack on the kidneys, it will attack the brain. And when they attacks the body, it's more severe, and so that doesn't mitigate against the possibility of other populations having it as well. But the African American population has a higher percentage, and the Latino population has it more aggressively.
Has there been any studies as to find out why?
Not that I know of as to, what is the genetic basis. I mean, that's something that is being explored now. Obviously, with new gene therapy, there's a great amount of research to figure out what is the genetic locations, the genetic markers that predict the prevalence of lupus, and then we can hopefully find a way to treat it accordingly if that research pans out.
Does the environment have anything to do with that?
Yeah. Environment is another contributor. They say, people who have been exposed to certain viruses may have a higher percentage of chance of getting it. We cannot say that there's something in the ear necessarily, but they do know that certain people in certain environments have a higher percentage of it as well.
Okay. Now, I do know lupus causes hair loss.
Yeah, that's right.
So could you just elaborate on that for us?
Yeah, sometimes patients, particularly with discoid lupus, would end up having, saying their hair starts to fall out, or they start to notice clumps of it actually starts to come out over a period of time. Or they may just have patches in their hair, their scalp, where they don't have hair. Balding patterns that actually begin to take place as a result of the lupus.
And that would be a first indicator that something's wrong?
Not necessarily a first indicator, because hair loss can come from a number of different things, but we look at a constellation of symptoms. That would be the joint pains, the muscle aches. If you have discoid lupus, you'll see these raised patches on the skin, as well as with the hair loss. And when you put the whole picture together with a test called the ANA test, we kind of get a strong indicator that this is what they have. There are a lot of people who actually have lupus, and it goes undiagnosed because it can be very insidious, so kind of slow and creeping up on people. And so it's important to have this in mind. If you say, I got these joint aches, I get these fevers, my hair is dropping out, maybe I need to go and get an ANA test just to see whether or not I'm a person who has lupus.
And so you can't look at anybody and say, oh, I know you have lupus. It's not that obvious.
No, because the rheumatological diseases, these joint type of diseases or autoimmune diseases, they kind of have a overlap. And so you'd have to go to a care provider that is sensitized to that and is looking for that. And, that's the way you can tell. It should say that there is a cluster that families, if someone in your family has it, then you have an increased probability of having it. If you have two twins, a set of twins, there's a 25% chance that if one has it, that the other one has it. That is, they are fraternal twins. Okay. So that means that there is some concordance or some correlation between genetic predisposition to the disease. So families may have it.
Okay, and so what kind of care, someone's been diagnosed, what kind of care can we offer a person with lupus?
Most of it's symptomatic management. So we're trying to manage the flare-ups. When they flare up, we give immunosuppressive drugs to kind of keep it at bay.
And so is there a reaction to the drugs too? Or?
Well, prednisone has its own reaction. Sometimes people swell up with prednisone. Sometimes people feel a little, they have some confusion if you have too much of it, But most times when you have low-dose prednisone or you have it adjusted for your symptoms, other than the weight gain, most
you didn't mention that one. Those weight gain too.
Yeah, weight gain, swelling up.
Okay.
That's one of the things that people have when they have to take high doses of steroid.
And this can last from. You said there isn't a cure per se, but it can be managed.
Yeah, it can be managed. So between the ages of 15 to 45 years old is when people usually present with it and begin to have it diagnosed. And it's a chronic disease that you will live with, and you just have to learn to manage with your care provider with immunosuppressive medications.
Okay.
Yeah.
So is there anything else you want to tell me about this lupus? I was telling our other guests that I had a friend about 30 years ago, and it wasn't that prevalent then, but it seems to have increased
Sure.
as far as over the years, as far as people getting lupus. That's why I was wondering if it was environmental factors
Sure.
that were contributing to it, or...
Well, one of the things is, when you're looking for something, you find it. So it could have been around before, but people may say, my joints hurt, or I've got a fever. So we sometimes have been labeling things as, something else, but it could have been lupus. But when you have the diagnostic criteria, and then people are looking for it, then we begin to identify it and say, this is exactly what this is. So then previously, when we didn't have the resources available to do the diagnosis and, confirmatory tests, and we weren't looking for it, perhaps we were having it, but we just didn't know that's what it was.
Okay, so one of the symptoms was hair loss.
Yes.
And so that is, a woman's crowning glory. What can we do to sort of arrest it or get it rejuvenated? What can
Well, there are a variety of approaches to hair loss and hair rejuvenation. And, they have those resources here in Bermuda at the Northshore Aesthetic and Medical Center, in which hair loss is actually treated with a variety of spectrum of approaches. So it's multimodality approaches to actually treating hair loss.
And we have success with those?
Oh, yeah. Over a period of 3 to 6 months, people have really demonstrated that they've had significant hair growth. And it isn't only balding or hair loss because of lupus, but, hair loss in general can be diagnosed, identify what's causing it, and finding a treatment modality that best suits it.
And so another symptom would be skin.
Yeah.
Explain to me what goes on with the skin.
Well, the discoid lupus in particular has these raised patches of painful areas on the skin, and they're shaped like discs. And they come and they go, and the joints often are inflamed as well with that. So, people may have it on their face. If it's in their scalp, then you actually have hair loss. Other organs that lupus can affect is the brain. You can actually have lupus affect the brain. You have to use high-dose steroids to cause you to, because it can cause inflammation in the brain, cause severe headaches, and cause seizures if untreated. Also, the kidney can be affected by lupus as well. Autoimmune antibodies attacking the kidneys, causing them to break down, and you can have problems with kidney disease. You'll have to see a nephrologist for that.
And so as far as the person's lifespan, does it affect a person? I mean, if it's if it's managed properly, can a person, relatively live a pretty long life? Or?
Sure. Now, one thing I should say is that other diseases, you have a higher percentage of chance. There's a high incidence of other diseases with people who have lupus. For example, people with lupus die at a significantly higher rate of cardiac disease than the normal population. So that is something that a person with lupus should be concerned about. Make sure that your heart is checked. Make sure you don't have any signs of cardiovascular disease. They also have high incidence of diabetes associated with patients who actually have lupus. Notwithstanding is the fact that being treated with steroids, you may have what we call iatrogenic diabetes, where you're taking on prednisone steroids and actually can cause increased blood sugars. So you do need to be managed closely. Can you have a good life? Sure, you can live with good management and good care. You can lead a reasonably good quality of life as well.
And as far as diet, I'm sure diet always affects everything.
Well, diet always affects everything. We go back to our basic principles of exercise and nutrition, significant for ameliorating most disease processes and help in the process of healing.
So what else? We're about to actually talk to the ladies.
Sure.
But before that, what else can you tell us about lupus that you haven't talked about?
I think we've covered most of it. One, symptoms are joint pains when they come up, flare-ups associated with fever. Number two, some patients actually have a different type of lupus. It may be associated with pregnancy or around the menstrual cycle. You actually see it manifesting itself. Number three, environmental factors are not necessarily, we aren't really sure exactly what causes it, but there are some environmental factors that make it worse. And last but not least, see a care provider. If you hear this presentation and you say, I wonder if I actually have that, or if I know a family member that has it, it doesn't cost much to just get an ANA screening test to see if you actually are a patient with lupus.
Yeah, that's actually the reason why we're doing this program. Well, we want to thank you, Dr. James, for imparting such knowledge about lupus. Joining us in our second half of Health and Family are two individuals who have been diagnosed with lupus. Stay tuned. We'll be right back.